Doctors don't have a crystal ball, but they do have something surprisingly close to one, and it isn't a blood test or a scan. According to research published in JAMA, Gait speed, simply how fast you walk, correlated with predicted years of life remaining across both sexes and every age past 65. Not your cholesterol, not your blood pressure, how fast you walk down a hallway. Tonight, the one specific change to your walking that the research says matters more than almost anything else, and it's not about walking farther, it's about walking faster on purpose. Quick note first, this channel is for general education, not medical advice, and I'm not your doctor. This isn't about diagnosing anything from a video. It's about understanding a genuinely fascinating piece of research and a simple, low-risk change you can start today after checking with your doctor if you have balance issues, joint pain, or a heart condition that affects exercise safety. Consider someone like Robert, a composite, not a real patient. 74 years old, walks his dog every day, feels fine, but over the past couple of years, without really noticing, his pace had slowed down. He wasn't unwell, he just wasn't in any hurry anymore. That quiet slowing down is exactly what this research is about, because it turns out that gait speed is one of the most studied predictors of healthy aging there is. Here's what almost no one explains. Your walking speed isn't just a symptom of how healthy you are, it's a real-time readout of several systems working together at once. It reflects your muscle strength, your balance and coordination, your heart and lung capacity, and even, according to some of the data, your cognitive processing speed. Slow gait speed is commonly used as a marker to help identify frailty and sarcopenia, age-related muscle loss, because when any one of those underlying systems weakens, walking speed is often the first place it shows up long before a diagnosis does. Think of gait speed like a car's dashboard warning light. The light itself isn't the problem, it's a signal from several systems underneath the hood reporting back at once. Dr. Matteo Cesari, in an editorial accompanying the original JAMA research, suggested gait speed may become a new vital sign, right alongside blood pressure and heart rate, precisely because it's such an efficient summary of overall health. Let's get into the actual numbers because they're more specific and more actionable than most health research you'll come across. In the pooled analysis of 9 major studies tracking thousands of community-dwelling older adults, a gait speed of 0.8 meters per second, a little over half a mile per hour above a slow shuffle, correlated with the median life expectancy for a person's given age and sex. Walk consistently faster than that, and the data lean toward longer survival. Walk consistently slower, and the data leaned the other way. Separate research found that walking just 0.1 meters per second faster was associated with a 12% increase in survival. A small, specific pace change tied to a meaningful number. And this next figure is the one I want you to really sit with. In a population-based study of people 85 and older, including people with dementia and mobility aids, those with a gait speed slower than 0.5 meters per second had roughly double the mortality risk over 5 years compared to the fastest walking group. This effect held up even in the oldest, most vulnerable participants in the study. It wasn't just a healthy senior phenomenon. Here's the part that matters most for what you do tonight. It's not just your walking speed today that matters, it's the trajectory. Older adults whose gait speed declined quickly over time had the highest mortality risk, even compared to people who started out at the exact same walking speed but declined more slowly. In other words, the direction you're heading matters as much as where you are right now, which means this is something you can actively influence, not just a number to worry about. Here's the mistake most people make. They hear walking speed predicts longevity and think the answer is simply walking more steps per day. That's not quite it. The research is specifically about pace, the speed at which you walk your normal, everyday walk, not total distance or step count. This matters because it means the fix isn't necessarily go for longer walks. It's specifically about training your body to comfortably move at a brisker pace during the walking you're already doing, to the mailbox, through the grocery store, around the block. The practical version of this, drawn directly from how gait speed is measured in the research, it's tested as a normal-paced, unassisted walk over a short, measured distance, meaning what's being measured is your natural everyday walking pace, not a forced sprint. So here's the actual change. In plain terms, pick one walk you already do regularly, the driveway to the mailbox, one lap of the block, the walk from the car into the store, and deliberately walk at about 10 to 15% faster than your normal pace several times a week. Not a jog, not a strain, just a noticeably brisker version of your normal walk, the kind of pace where you'd still be comfortable holding a conversation, but you'd need to take slightly quicker or slightly longer steps to keep up with yourself. Why this specific approach, and not just exercise more in general? Walking speed is trainable in a very direct, specific way. The muscles, balance, and coordination involved in faster walking are the same ones the research is measuring when it tracks gait speed as a health marker. You're not just getting exercise, you're practicing the exact skill the research says matters. A few honest caveats, because this niche deserves honesty over hype. This is associational research, not a guarantee. Walking faster doesn't directly cause longer life on its own. It's a marker reflecting several underlying systems. Some of those underlying factors, like knee strength and body weight, are modifiable, which is actually good news, since it means some of what drives this number is within your influence, not fixed by age alone. And if you have significant balance problems, joint pain, or a heart condition, talk to your doctor before deliberately increasing your walking pace, since safety always comes first. Here's why this matters. Your walking speed is quietly reporting on your muscles, your balance, your heart, and more, all at once. And the research is consistent that both where that number sits and which direction it's heading matter for long-term health. Tonight's plan is genuinely simple. Pick one walk you already do this week and walk it just a little faster than usual, enough that you notice it, not enough to strain. Do that consistently, and you're directly practicing the one measurable habit the research keeps tying to healthy years ahead. If you have balance concerns, mobility aids, or a heart condition, this is exactly the kind of simple-sounding change worth running by your doctor first, not because it's risky, but because your specific situation deserves specific guidance. If this gave you something simple to actually try this week, type PACE in the comments below. And if you want to know the specific muscle strength exercises, research links to protecting your walking speed as you age, the ones that keep that number from quietly declining, that's exactly what the next video covers. Watch that one next.